Hello, my name is Dr. Tread Rissacker, and I am a doctor of chiropractic, and I want to welcome you to my Dr. Tread TV. And this is the first module of my cardiovascular disease presentation. And we're going to be using a little screen share here so you can see it and see it happen real time. I'm going to be going over some text and going over some information about anatomy and about physiology and about overall what is cardiovascular disease. I think that's really important to know that. The major risk factors of cardiovascular disease, how obesity, diabetes, and genetics has a huge role in cardiovascular disease. Also, how is cardiovascular disease diagnosed? Electrocardiograms, echocardiograms, blood tests. Also, the symptoms of CVD, we're going to call it, cardiovascular disease, CVD. And the mechanisms of cardiovascular disease, how does it happen? Also, the impact on your health, overall health, not to mention treatment options and medications that are necessary. Or suggested lifestyle changes that will help with cardiovascular disease, surgical interventions, prevention of CVD, cardiovascular disease, and early detection. And I think it's really important to understand that cardiovascular disease is one of the leading causes of death in humans. Okay, it's literally 1 out of 2 of you are going to die from a heart attack or cardiovascular disease. Now, the term cardiovascular disease is a description of many things that are happening, which eventually lead to the heart attack or a stroke or another problem within your body with the vessels. And because cardiovascular disease is so prevalent, it's so common, we're all going to have some part of it over our lifetime. It's just ubiquitous with being alive. Over time, your heart, your vessels, your lungs, these all can get wear and tear, and crud accumulates within them. Damage occurs, and eventually it can create something which could be life-threatening. And they name it a disease. Now, just to understand how prevalent heart disease is, it's the number 1 cause of death, 1 out of 2. So you look at your friend, one of you are going to have heart disease and die from it. Out of 1 out of 3 will die from cancer. So that would be number 2. Heart disease is number 1 out of 2 people. And with cancer, it's 1 out of 3. And it's an interesting statistic was when I had first learned about these statistics, it was in the late 80s. I had just started practicing chiropractic, and I looked back at the 1960 stats is when they started to actually do records of heart disease and cancer rates. And your chance of dying of heart disease in the 1960s was 1 out of 10. 1 out of 10. And today, it's every other person. Now, the same statistic with cancer was available back in the 1960s, and I was born in 1960. And cancer was 1 out of 30, which is incredible. 1 out of 30 people actually died from cancer. Today, it's 1 in 3. So I think it's important to bring this information about cardiovascular disease in a format that you can come in, you can look at it, you can tune in, and you can learn it in steps. There's actually, I believe, 17 different steps and modules. I don't have the exact number, but let me see. I'll tell you exactly how many modules are. So there's going to be 15 different modules that are involved with cardiovascular disease. I'm going to go over one each segment. Okay. And then after 15 shows, you will have enough information where you can watch them and learn all you wanted to know about cardiovascular disease. Now, I am not a heart surgeon. I am not an anatomy professor. I'm a doctor of chiropractic. I have some knowledge, and bear with me because, a lot of this information is coming from places that are much smarter than me. But I'm here to bring this information to you so it's something that you can learn from it. All right, let's get to it. So what I want to share with you right now is I want to share with you, this is the normal heart, okay? And what you see in this heart is you see the blood vessels that come up out of it. I'm tracing it with my mouse. And these are the atriums. And this is the aorta. This is the main artery that feeds blood to your body. The heart pumps the blood up this aorta. These three large vessels attached to it. One is your brachial artery. It goes into your right arm. The other one on the side goes into your left arm. So this brings blood supply to your arms. And then the one in the middle actually goes up and goes up to your brain. It's called the, I don't know the exact, I'll go over the exact names, but this one brings blood supply to your brain. And the artery that you see here in this picture that is purple colored, this is to reflect that this is where the blood comes back into the heart. Okay, and this would be from your lungs. Okay, and what we also see here, it's not really from your lungs. This is from the other parts of the body. This area here, this is the lung arteries that go to the lung, and on the left side and the right side, it looks like a little branch is sticking out. And this is the blood that goes back into the heart that's unoxygenated. And we'll go over it more in detail, but that's just what this picture is kind of showing you. All right, so the structure of the cardiovascular system, it consists of basically pipes that are connected in series and in parallel. These are the blood vessels that form a closed circulatory system. In the center, there are two pumps right there, the heart ventricles, two heart ventricles, and they maintain the pressure gradient that creates blood flow. So that's what you feel when you feel a bump, bump, bump. Those are your ventricles contracting and relaxing. The left ventricle pumps oxygenated blood through the aorta into the systemic or greater circulation. It then travels into large arteries that leads to your organs. These arteries are arranged parallel to each other. The large arteries branch into smaller arteries until they become arterioles. These in turn branch into capillaries where substances, oxygen, nutrition, are exchanged through something called diffusion. The number of vessels constantly increases while their diameter decreases. So closer to the heart, we have the large arteries. As it goes farther away from the heart, there's more vessels, but they get smaller and smaller. Now, out of the capillaries, which is the very end result of these arteries and arterioles, the blood flows into smaller veins called venules. The veins drain blood into the superior and inferior vena cava, which is a large vein, by means of the skeletal muscle pump and the venous valves, which prevent the blood flow from flowing back into the periphery. Now, that's an important thing to understand. Your heart is the pump, has a mandate to circulate all of your blood every single minute, approximately. 1 minute, all of your blood is circulated. And the pump does that job through pumping into these arteries and stuff. But once the blood goes into the capillaries and it's actually transfers its oxygen or its nutrients, the veins, the venules, called veins, pick up that blood and they carry it back to the body. That is performed by the skeletal muscle pump. So there is no pump for your venous blood. It's through the skeletal muscles. Okay. And that venous valves are in the veins, which prevent the blood from flowing back towards the cell. And every time you move your muscles, you're actually helping with venous flow. So here's the first takeaway from this. If you don't move your body every single day and you're not doing some form of movement, it doesn't have to be strenuous exercise, but you are not able to clear out the venous blood flow very efficiently. And when venous blood flow is impaired, just like if your heart was impaired, your health suffers. So this is one of the reasons why when somebody says, I don't like to exercise, I don't want to do this, it's probably not a real good idea, because we need exercise to activate the skeletal muscle pump, which moves the venous blood from the tissues back to the heart and through the organs so it can get cleansed. Very important. All right, so these just show some pictures of a large vein, a medium-sized vein, and what they call a venule. Both the superior vena cava and the inferior vena cava lead to the right atrium of the heart. Now, in the venous system, the number of vessels constantly decreases while their diameter increases. So it's just the opposite of the arteries. With atrial contraction, the blood is pumped into the right ventricle. Now, the right ventricle, remember there's two ventricles. There's a left ventricle and there's the right ventricle. The atrium is what pumps the blood into the ventricle itself. And then there's a little valve that closes, and then the right ventricle ejects the blood into the lungs, called the pulmonary trunk, into the lung circulation or pulmonary circulation. It then travels into the pulmonary arteries, which branch out within the lung until they finally become arterioles and capillaries one more time. Now the blood can be oxygenated by means of diffusion across the alveolar membranes while carbon dioxide diffuses out. So this is respiration. This is your blood moving from the artery, from the atrium into the right ventricle, injected, it's pushed into the blood, into the lungs by the heart. And then it gets the branches get thinner and thinner from arterioles to capillaries. Then when it goes across the alveolar membranes, which are the little sacs, carbon dioxide diffuses out and oxygen is brought in. So the veins and the venules and the veins and the four large pulmonary veins, the blood is circulated back to the heart, and now it goes into the left atrium, which is the top of the heart. The left atrium, with atrial contraction, moves the oxygenated blood into the left ventricles and has thus completed one round through the circulation. One round normally takes 60 seconds. And the circulation time can be determined with the use of dye. Pretty amazing, huh? So that heart is working all the time. In fact, I had read some studies on the heart. It said that in your lifetime, your heart pumps enough blood to actually float a battleship. If you were to take a battleship and put it in a dry box and the heart was going to pump the water into it, your heart pumps enough fluid in your lifetime to float that battleship. Incredibly effective machine that we have in our body. And again, you don't really have to understand the atriums and the ventricles and where the blood goes. Just know that the blood has to be circulated every minute, every 60 seconds. All the blood circulates through the body. That oxygenated blood with nutrition and oxygen, is pumped from the left ventricle, and that moves into all of the tissues of the body, organs, muscles, up to the brain, into the glands, everywhere. And then once that blood is diffused into the tissue and nutrients are absorbed, then venules, the veins, carry the deoxygenated blood back up to the heart, and then it gets pumped into the right ventricle, which then pushes it into the lungs for the transfer of oxygen, for the removal of carbon dioxide, the intake of oxygen, and then it's pumped back into the left atrium, and that's the circle. That's the whole process. And again, it's good to have a strong heart. I think I don't have to tell you that. Most people understand that. But what they don't understand, and where a lot of people have a problem, is in the veins not being able to get rid of the blood. And this is what creates a lot of the circulatory problems that we see with people. Remember, it's a closed system. And if one part of the system is sluggish or not allowing to move through, that's going to cause things to back up in the other part of the system. And we call that edema or dropsy or ascites. And what that means is the fresh blood is pumping from the heart, but the venous uptake has been impaired. Maybe it's just because you're not moving enough, or there's a blockage somewhere within your organs, your heart, not your heart, your kidneys, your liver, your pancreas, other areas. Really, usually it's the kidneys or the liver that will have congestion. And that causes the venous blood to be restricted. And because the heart is still pumping blood into the system, the fluid escapes into the tissues. And that's what we call edema. And typically it'll trickle down from your abdominal area down through your legs, and it collects in your lower legs. And that's why you see people with swollen ankles, swollen feet, a bilateral swelling. When you have swelling in both feet, that's typically a problem higher up in your body, an organ failure possibly, or a restriction of the blood flow affecting the edema, and is trickling down into both legs. Now, if it's in one leg, just one leg, normally that could be from a problem with the venous flow within that leg, or an injury to the leg, like a sprain or strain, not necessarily systemic. Now, there's ways of determining if the swelling in your legs or feet is systemic, with an organ problem, or if it's from an injury like a sprain or a strain. And it's something called whether it pits or doesn't pit. All right. So it's called pitting edema or non-pitting edema. So if you have a swollen ankle and you put your finger and you press into that swelling and you hold it in there, and then you take your finger off, if it leaves an indentation, that's pitting edema. And that's very indicative of a problem up higher in your body and your organs, creating fluid to collect in your feet, because there's no way, this is what it causes, is swelling, and it pits. If you have swelling in your feet or ankles and it does not create that edema, that pit, you push pressure on it and it doesn't leave an impression, typically that's a sprain or a strain of the joint in that area. Just something we learn as doctors, a rule of thumb. Now, please, if you have swelling in your ankles, swelling in your feet, you need to get to a medical doctor very quickly to find out why this is happening. We see a lot of people with edema all the time when I do my intakes with people. And I've actually had one woman who came in, and, remember, I practice weight loss. And when she came in, her history was that I was really doing well. She was in her 70s. And all of a sudden, I started to gain weight. And I mean, she said she put on like 20 pounds in less than 3 to 4 weeks. I was like, that got my attention, because you can't make fat that fast, but you can sure retain water and gain weight. And, most of her abdomen was very large. She looked obese. And as I went down and I checked her feet, she had pitting edema. There was fluid that were collecting in her feet that had that pit in it. And I looked right at her and I says, you need to go to the hospital. This isn't fat. This is fluid that's gaining in your midst, in your belly. And you got to find out why it is. It's not a weight loss problem. It's not something you can eat or diet or exercise away. She took my advice, went to the hospital, and they put her into, she had a blockage in her, or actually it was her heart valve was not functioning properly. And this caused the buildup of the fluid. And over time, she became, bloated with water. And boy, it saved her life. And she came back and thanked me for that, for pointing her in that direction. So That's one of the basics of understanding about called fluid mechanics of blood circulation. So let's see where we're at with time. Okay, we got another 10 minutes here. So that's kind of a summary. Let's go back and just look at that heart again one more time on my sheet. Now here we got the left ventricle and the right ventricle, and this over here is the left atrium, and this is the right atrium, and these are the vessels that feed blood to the body. Okay. Now, we are not going to worry about hemodynamics. You don't need to know that, but you might need to know something about pressure and something called systolic blood pressure and diastolic pressure. All right. Everybody gets their blood checked, right? You know, their heart, their blood pressure. And normal blood pressure is 120/70. Okay. Now, some doctors will make it differently, but it's 120/70 should be. And that means that the systolic pressure, the first sound you hear when you put on a blood cuff and you hear that pulsing, the first sound is the systolic blood pressure. And I was taught that the systolic blood pressure is actually the ventricle, left ventricle, pumping blood into the muscle, organs, and systems of the body. So that's got a lot of pressure behind it. 120 is pretty good. Now, the second sound you hear, which is a boom, boom, it sounds less and it will measure less, is called the diastolic pressure. And basically, the diastolic pressure has to do with the venous pressure, your venous system, how much pressure is being utilized by the veins in the venous system to bring that blood back. So what happens is if you have an elevated diastolic pressure, which is the lower of the two numbers, if it's over 70, it's 80, it's 90, this is a lot more of a risk than having systolic pressure, which might be up around 140 or 150. You know, and I was taught as a young doctor that that's important to know that. So it isn't, you know, high blood pressure can be very advantageous to you because it might be preparing you for a fight or to run or some stressful event. And if your pressure didn't go up, you wouldn't have the blood supply to make the muscles move and to perfuse the body. So blood pressure can be elevated pretty easily. But the diastolic pressure, the one that's the lower number, the venous pressure, if that is elevated, that's pretty indicative of that there's a problem in the body. So just be aware of that. So 120/70 is normal. Now, when checking your blood pressure, because this is something that we are responsible for as humans, you know, we can't trust the doctor always to check our blood pressure. You should, if you're concerned about cardiovascular disease and vascular disease in general, it usually leads to higher blood pressure because the arteries and the veins are becoming stiff and they're becoming less pliable. They're not elastic anymore. They lose their elasticity. And that creates the heart to have to pump harder to move the blood through the body. And the best analogy I can use for that. So part of what allows your body to move blood through the body very easily without taxing the heart is the elasticity of your arteries and your veins too, but mainly the arteries. And they need to have elasticity. As you get older or your diet is not good and you start getting what we call arterial sclerotic plaquing and a collection of fatty deposits within the arteries, they form a hardening of the artery. And that elasticity starts to get less and less as you get older. And this is a real indicative of somebody who's going through cardiovascular disease. Now, what happens is I had someone I love dearly died from heart failure, and this is exactly what happened. And I didn't understand it when I first found out what happened. But as I learned about it and understood it, it made a lot of sense to me. So what happens is, remember, your heart is pumping blood through your vessels. And what helps the blood move through the vessel is the elasticity of the vessels. So let's use a balloon as an example. A balloon is very elastic, right? It's stretchy. It has a lot of elasticity. And if I was to fill up the balloon with air or water and fill it all the way up and then squeeze off on the end, if I was to let go of that, the elasticity of the balloon is going to move the water out of the balloon, right? It's going to squirt out, or the air. Okay. Now, what if I took, and that's because of the elasticity of the balloon, and the same thing goes with your arteries. Now, what if I took a Ziploc baggie, a gallon Ziploc baggie, was able to close off most of it, fill it with air, seal it, and then put a little hole in it? Would the air be forced out? No. The air would basically stay in there because there's no elasticity in a Ziploc baggie to move the air out. So let's go back to the vascular system. When you have elasticity in your vessels and your heart is pumping, the elasticity is making its job a lot easier. It's moving blood through the body, because when the heart pumps, it creates, the artery gets a little larger. And then when it shuts down, the artery elasticity collapse, causes it to constrict again, and that moves the blood. So what if you were a human who was alive for 60 or 70 years now, and halfway through your life, in your 30s or 40s or 50s, you developed hardening of the arteries. Your arteries became hardened from cigarette smoking, eating the wrong foods. There's a lot of reasons why. I'm not going to go into them right now, but just know that we get hardened arteries. And it's called cardiovascular disease. Now what's happening is that hardening of the arteries it doesn't help the body to move the blood anymore. So instead of getting the assistance of the arterial elasticity moving the blood every time the heart pumps, the heart has to do all that work on its own without any help from the arteries. So just like if you were moving water through a bunch of pipes without any elasticity, you'd have to blow harder, wouldn't you? So, and work harder to get the blood to all the parts of, remember, it has a mandate every 60 seconds, the blood's got to be circulated all the way through the body. And when your arteries get hardened, the heart has to take up that extra burden. And that, my friends, is one of the causes of heart failure. All right. It happened to somebody I love dearly. Not going to mention who, but you could probably guess. And he loved smoking. He's from the age where everybody smoked. They smoked on TV. They smoked in ads. You were cool if you smoked. It gave you a chance to relax. It gave you time to think. Your friends smoked together. You could not tell this man that smoking was a bad thing. He enjoyed it. And he made a promise to all of us that he would take care of his health and do, things to preserve his health, because he was not going to get lung cancer. And he did not die from lung cancer. He died from heart failure at 78 years old. His heart just was tired. 2 years before he passed, he was having problems with energy, low energy, muscle aches. I'm fatigued. I don't know why I'm tired. I don't have any energy. I have no will. I have to struggle to get up a stair or two, His heart wasn't showing any signs of disease, but the heart was overtaxed for so many years trying to move blood through hardened arteries that it gave up the ghost, it really did. And then what happened, the symptom of that was pneumonia. fluid in the lungs, fluid backing up. Remember, when the heart doesn't allow the blood to be completely circulated, fluid backs up. Hold on one second. All right. Sorry about that. My camera maxes out at 30 minutes. So as a result of that fluid backing up, he developed pneumonia. Okay. And, the doctors are like, well, maybe he breathed in some bacteria or COVID jumped on him or. I was like, I don't think so. He'd never been sick like that. He's pooped out. I don't know why he's so pooped out. And we managed to get this loved one to a clinic where they did what they call a cardiac ejection test, cardiac to see how effective your heart was moving blood. It's called an ejection ratio, I think. I'm not sure, but it should be like 70% or something. His was 14. And when the doctor came in and told me that he was in severe heart failure and there was very little that could be done, it was tough. And I said to myself, damn, it's got to be this, the hardening of the arteries over the years seemed okay, but it causes the heart to fail. So that's kind of why I'm giving this story here today about the heart and explaining it. And we're going to go into it a lot more, but I always like people to have a takeaway, something they can remember that I'm going over here. And one of them is that you got to exercise and move so you can circulate the returning blood back to the heart, back to the lungs. Of course, we want the heart to circulate blood to the body, which is why we exercise and keep the heart strong. But that happens even when you're not exercising. The exercising and the movement is what moves the venous blood back to the body. And that is something that if you're not moving, you're not helping your body to cleanse and to get all the blood where it needs to go. And your diet and toxins in the environment have a lot to do with why your body, the food you choose to eat has a lot to do with this chronic hardening of the arteries over time. And it's going to shorten your lifespan, most likely. All right. So that's about it. Let's see if there's anything else here I think is important. It's important to understand the structure of the arterial wall that you see here. And, this is a pipe, and inside here is smooth muscle. So this is not only is it a pipe, but it's also a pipe which can get smaller and larger. It contracts and relaxes. There's very few pipes that do that. Okay. A PVC pipe is one diameter unless it gets clogged with stuff. But your body, your arterial walls, in an effort to move blood to certain areas and cut off blood to certain areas, restrict blood, such as swimming, there's smooth muscle in your arteries. And that smooth muscle is controlled by your nervous system. And it's, so you can have something called a vasospastic disorder. Vaso means vessel. Spastic means a contraction of, like a serous contraction. And that can happen to the arteries your coronary arteries, which feed blood to the heart. So some people, through stress and anger and situations, can actually have a spasm within their chest, which can cut off the blood to the heart and cause a heart attack without having any cardiovascular disease at all. And, it's just to know that we have this muscular wall. And then what happens is, as we start to eat foods that are not healthy and we have a lot of inflammation in our body, these inflammatory molecules, they start to collect around the lumen, which is the inner part of the artery. And as it starts to collect around there, it's almost like calcification. It gets harder and harder until the arteries not only do they don't stretch, you lose the elasticity, but they can no longer contract because they're so solid. Important to know that. In older people, the strength of the arteries and with it, the pulse wave velocity increases. Other than age and distance from the heart, the arterial pressure has an influence on pulse wave velocity. You don't have to know that stuff. And then, of course, that's the high pressure system. And the low pressure system includes the veins and the vessels leading to the heart of the greater circulation, the right heart, the pulmonary vessels, and the left atrium. During diastole, which is the lower number of your heart, of your blood pressure, the left ventricle is also part of the low pressure system. So we need to be cognizant of the fact that there are two systems: high pressure, arterial, low pressure, venous. Now, what this picture shows right here that you're looking at is a blood vessel. And when the muscles are relaxed, the valve is closed. You see these little valves? Now, this valve is going to move blood in the direction from the bottom of my screen up to the top through these valves. Now, what happens is the blood is moved when these two muscles contract, and it pushes into the artery, and this valve opens and allows the blood to move up. And then when the muscle relaxes, the valve closes. And this is the skeletal muscle pump. Again, if you don't exercise and move your body, this reaction is severely impaired, and you'll have a buildup of venous blood, which is blood that's been oxygenated, blood that contains waste products from the body, and you're not able to efficiently get rid of them. One of the things we use at my Slim Body Spa is a whole body vibration plate. And a vibration plate is a device which moves the skeletal muscle pump. It's also something that you can get if you ever heard of rebounding, which is jumping up and down. You can get it also. All right. I'm going to end this recording. I have something I got to do. And I hope you learned something about the muscles and the substance exchange. When I pick up on the next program, I'm going to go over and complete more of this. So this is module 1, which is really normal anatomy and normal high blood pressure and low blood pressure and things you can do. Okay. I thank you for tuning in. Share this with somebody else. Remember, I'm going to do this every day, and you'll get to see after 16 days this whole progress. All right. Thank you so much.